let me
Okay.
just remind you about the some of the technical options. Okay, so this is being recorded. You will be able to watch it tomorrow as well. And today with us we have Jana Rapno, who is a psychotherapist and author of Free Makes Baby. She will start with the presentation that will take approximately 10-20 minutes. And after that, we will start with our Q&A session. You can type in all your questions in the chat section. Okay, I hope all is clear now. And now let's start with the presentation. Okay, Jenna?
Okay.
Go
So
ahead.
I am a therapist in Dallas, Texas, USA, and I have been working with patients and couples for 10 years now, independently. So I just work for myself. And I have been working with clients like you for 10 years, and I also have my own experience with infertility. We had secondary infertility, my husband and I, and so we adopted our daughter from China. And here's a little picture that that you can see, hopefully, of my family. This has been some years ago, and so my kids are a little bit older now, but that is kind of captures the essence of our family. We did international adoption, and we were able to adopt our daughter from China. In between those years, I was infertile for like 14 years. I was able to get pregnant again in 2014, but that ended in miscarriage. And so way back then, I started counseling, and I counseled people that were going through adoption, that were doing egg donation or sperm donation, or even more recently, embryo donation. And so what I started to hear was a lot of stories. They were so varied, and that I didn't have enough time when I was meeting with people to really cover all their issues, all the things they needed. And so, as you can see on this picture here, I published a book called Three Makes Baby: How to Parent Your Donor Conceived Child. And in this book, I share the feelings and concerns of couples that I've seen in my practice. I give strategies for coping with your feelings and concerns, and we're just going to get right into it. Today, I'm going to give you a glimpse behind the doors of my office, the counselor's office. I call them, sacred secrets, because these are people's stories that I really have a lot of respect for, a lot of reverence for. They've been through so much by the time they get to my office, and I really respect the journey they've been on. It's been a difficult journey, and some of them have never said the things they say to me to another person. And so I really respect that. I respect that what you share with me. I know you've walked a million miles by the time you've gotten to my door, and I know you're tired and discouraged, and I know you've seen sometimes more disappointment than most of us can imagine. So of course, I've changed the names and details of the people in the book to protect their identity and to keep, protect the sanctity of my counselor space. But I want you to go ahead and take a look inside with me. I began to see common questions that that parents were having, or parents to be were having, about the process. And when over the years, seeing those same issues come up over and over, I decided to help organize the concerns that parents were having. And sort of what I saw was a lot of emotions. I saw questions like, will my child be upset with me? Will I feel like the real mom or dad with a donor conception? Will we be different from other families? And will our family members embrace our child, our extended family members and friends? And how do we tell our child about this, about donor conception? And so I saw so many feelings: resiliency and hope and excitement, adaptable families that could come to terms with acceptance of where they were at. But I also saw so much anxiousness and sadness and anger and fear. And so one of the most common feelings that I've seen through this process is confusion. And in the adoption field, we know that we have a term called genetic bewilderment. And basically what that means is that it's really hard for parents to wrap their mind around what it means to be different, what it means to be genetically different from their child. And so we experience that as well in the donation community with egg donation. And it's common for the parent that is not genetically related to also feel this sense of bewilderment. And so that confusion is what made me realize, there's so much more I can do to help families work through all these feelings and all these confusing things that they're thinking about. And so I wrote the book, Three Makes Baby, pictured here. I pictured on the front page and right here as well. And I wrote this as a guide for parents to really be able to figure out what they were feeling and make sense of it. What I saw was 5 common concerns, like I said, over the years, and they're listed here. And so what those are is, I'm worried my child's going to be upset. What if I don't feel like the real parent and the parent legitimacy? How about social differences? Are we going to feel different than other families? Is this going to be hard to explain? And so family and cultural differences, will our own family be able to accept this difference in our child? And then not knowing how to talk about it, not knowing what to say or when we should talk to our children about it, when we should tell others about it. And so these were the 5 concerns that I saw over and over in my experience working with other families. So what I'm going to do is I'm going to give you, real quick, one thing I did is on page 26, I did create a little checklist right here. And what this checklist does is it allows you to identify with concerns that you might have about donor conception and the statements. And it gives, once you check these boxes, then it kind of tells you what category you're struggling with the most. So maybe you're really worried about your child, it's emotional distress. Maybe it's feelings, the social aspect. I'm feeling socially different. So that gives you an opportunity to really see where you are, because I've had so many parents come in and say, I'm bothered, I'm concerned, I'm worried, but I don't really understand why. And I'm still trying to figure it out myself. So this book really helps you to identify your feelings and concerns and be able to give you strategies on how to work through those. But in case you're still wondering, I don't know where I fall, I'll give you a few examples of stories that I've actually seen in my practice, and to kind of give you some ideas of what I'm talking about. So in the case of Paige and Colton. So Paige and Colton needed an egg donor after secondary infertility. So like me, they had a biological child, but she was 2 years old at the time and genetically related to both children, but couldn't have a second child without some help. And she had diminished ovarian reserve, and she wasn't able to have another child with her eggs. And when Paige came to me, she was really concerned that her second child would feel second best to their firstborn child. And so she was very, very concerned, and she had decided she did not want to tell her second child about the donation or either children, because she was worried about them feeling different. And as we got even deeper into the discussion, she even admitted that she was afraid she might feel differently about the children, that she might actually love her firstborn child maybe more, or have different feelings. And that really, really bothered her, and she felt a great deep sense of pain and struggle around that. She had a huge heart, and she really was a loving mom and wanted to give the most love she possibly could. And so what I talk about, that is where you were looking at that emotional distress. We're worried about our child's feelings. Will they be upset? And will they have issues with being donor conceived? What challenges might they have? And so that's when we talk about that. So what I want to do is kind of tell you what I talk about in this case is I talk about the fact that we have a lot of intense feelings around infertility. And when we're going through the infertility process, we're in basically the part of our brain that's in charge of emotion. And we're in there in a chronic state. We kind of stay there. We're in stress and we're emotional. And so we become almost chronically emotional. And because of that, it can bring up even more intense feelings. And we then think that our child will have those same feelings, or we worry that those feelings will be our child's as well. And so I can't talk about feelings with infertility without talking about infertility grief and how much grief we experience going through infertility. We have multiple losses, loss after loss, from failed pregnancies to failed pregnancy tests to procedures that didn't go right to, a miscarriage. So you can have so many losses along the way that it becomes this compounded grief or complicated grieving process. And that is really important to attend to and to look at your own feelings and make sure that you're really taking care of yourself and that you're figuring out what your feelings are first. Because sometimes we tend to project our feelings onto children. And so I challenge you to figure those out. And I give you things in the book that you can, identify what feelings you're having along the way. And then to distinguish those feelings from your child's feelings, because they may be very different. And so a lot of times, like I said, we put our feelings onto our children, but they may be different. I give an example in the book of a scene where, a child's outside playing and they can feel the sunshine on their face and the earth beneath their feet, and they're just feeling great, just like we do when we're little. And then they walk inside to see their parents arguing. In one scene, the parents stop and they help the child get a glass of water, and the child goes back out and plays happily. In the other scene, the child comes in and the parents don't separate their feelings and yell at her for getting grass or dirt on the floor, and she runs to her room crying. And so now their feelings have become her feelings. And so that distinguishing of our feelings is really important when we're looking at how do we feel about this process, and then can we heal that? Can we move forward and then give our child sort of that almost clean slate to operate from? And that's a great place to start. So I'm going to give you another example. Okay. We have a repeat slide there. There we go. Okay. Moving on to Alice and Wyatt. So Alice and Wyatt, they are doing a known donation. They planned to use their sister's egg to conceive. And they wanted to do that because they wanted to keep the child as close to the family as possible. But when Alice came to see me, she was really concerned that she would feel like it wasn't really hers, that it was her sister's, and that maybe her sister would be more legit. Her sister was able to have children already, and that she was even worried that her child might bond more with her sister as being the parent. And so they really didn't want to talk about donation in that case. In that case, we talk about parents feeling legitimate or not feeling legitimate. They're worried that they're not going to feel like the real mom and dad. And I've heard this a lot. What if I don't feel that way? What if, my child wonders about their donor and wants to know more, or wants to know their donor? And what if their donor is really special to them and not as special as I would be? Sometimes they say, I don't want to treat this any differently whatsoever than having a genetic child that's exactly the same. And so then I know they're concerned. They sometimes have some concerns about those differences. When we talk about legitimate parenting, we know that parenting is not so much about biology as it is about attachment, the attachment process. And when we bond and we attach, it's when we spend time, mostly attachment, we spend time with people over and over. And that's what parenting is. And so a lot of people have never had experience with non-biological families. And so they just think that family is biology. And we know that family is so much more than that. It's so much more. And so sometimes it's just a lack of experience with a parent or a family member who isn't genetically related to you. Speaking from experience, I know, I've always known that. I was actually adopted at 6 weeks old, my twin brother and I, and then we adopted our daughter. So I've experienced it both as a child and a parent, and I can tell you that there's a lot of legitimacy that I feel legit, and my parents felt legit, and so I can help put people's fears to rest around that topic. The next case that we talk about is Braden and Gwen. So I'm showing you a slide now. Hopefully you can see that. So Braden and Gwen have 0 sperm. Braden was diagnosed with that, and they need a sperm donor. They're a young couple. He came to me, he was very embarrassed that he couldn't get his wife pregnant, and he really didn't want anybody to know. He didn't want family to know. He didn't want especially his buddies to know. And so he was very against and feeling very, very badly about this process. And his wife was trying to help him to come to terms with it. So when we look at these issues, that's oftentimes about those social differences. I don't want to bring attention to it. I don't want to. I don't want to feel worried that people will respond to me in a weird way or ask me weird questions. And I don't want to feel differently from other families. And so that can be really difficult for people when they're going through this process of trying to figure it out. Is how will we tell people? How will we fit in? What if our child gets asked questions at school about it and they have to answer questions about it that make them uncomfortable? What will we do? And so I go into the book, I go into, embracing differences and taking some time to really analyze and assess how you feel about differences. And, do you like to fit in? Do you want to conform? This might be a process that you have to go through in learning to embrace differences in your own family and what that feels like. And I also, I really do find that families with that are different on some level do kind of go through a process of adjustment, of getting used to that. It's almost like acclimation into a new culture in a way. It can be. And so I talk about that in the book as well, about what that acclimation process looks like and how it can be really challenging at first. But then over time, as you learn to accept it, it becomes easier and easier. The last thing I want to tell you about is an egg and sperm donation. This was when a family that was looking at cultural differences. And so Jose and Tina used a double donation to build their family. They wanted their child to look like them. They wanted to have, the same ethnicity mix. And so they were really concerned that their family members, because of their cultural beliefs, would not accept this type of having a baby this way. And so they were so afraid that the family members might reject their child. And that is a legitimate concern. There are some places, cultures, families that just have a hard time understanding. And so that is social or family or cultural differences. What if the family members treat our child differently? Or, what if it's just so wrong in our culture that we can't talk about it? So these are very difficult challenges. I do work with families on how the difference between being private and being secretive. And there is a difference. We can keep our privacy to our small little family, us and our children. And that's the right to privacy without it being a secret from our child. And so the main difference is that, there is a difference between privacy and secrecy. Secrecy is that when we keep stuff from people who need to know that information, and then privacy is just when we keep stuff that we feel is personal to ourselves. And so when I talk to people, I talk about how secrecy is when we don't tell our child, then we're keeping information from our child that they need to know their genetic information. And so it's important for them to know for health reasons and for identity development. And so that's when it falls into more of a secret. And then the last concern is, is when and how to tell the kids. And so a lot of people say, hey, I'm good with everything else. I'm feeling really comfortable with this. We've had a lot of time to get used to it. But I just don't know how to talk about it and what to say. And so this whole second half of my book is how you talk to children about it, depending on their age. So it does depend on, if they're a preschooler or a teenager, you're going to use very different language and use very different approach to it. And so I give you very specific information along the way of how to do that, including like phrases that you can actually use. And I can't end the presentation without coming from the kid's perspective. And the reason is that I was one of those kids, but also because that was the goal of my work, was to really give parents that child's perspective before they're here. And one of the main things that kids do wonder is they wonder why my parents aren't talking about this. If you think that the child is going to bring that to you and say to you, hey, I want to talk about this, donor thing, they're not. It's just usually not how it works. They may have questions, but if you don't establish a bit of an open, environment of talking about it with them, then they probably will think that's a taboo topic, that's off limits, and I'm not going to talk about it. And you might say, well, why should we talk about it? Well, it's part of who they are. It's part of their identity, and it helps them to understand that their children, they don't have the brain power that, at small ages to really be able to comprehend a lot of stuff. We're the guides that help them along the way to give them the accurate information about who they are. So that's sorry about the technical difficulties. I would love if you want to get in touch with me. Here's the information, how to contact me, reach out to me. And you can also follow me online at Jana Repnow LPC. And I'd be happy to answer more questions. You can grab my book on Amazon. It's available now in most countries. So yeah, I'll take it for, I guess, for questions now.
All right, perfect. Thank you so much, Jana, for the presentation and giving us some tips as well. Okay, I believe we are able to move on to our Q&A session, but let me have a look. If we have any questions, then just go ahead and type them in. I am sure, Jana will be happy to answer your questions, so go ahead. We can start right now.
One thing I didn't, because I wasn't sure if we were going to be able to get the good material in, I wanted to read a little bit of the story because I felt like it was important to give people a perspective of where people are coming from when they come to my office. So it's how I opened the book, actually, and it's the story of Susie and Lance. And I write about, just really quickly, Susie and Lance sat in my dimly lit office across from me. Their discomfort obvious despite their polite small talk. Their hearts were broken, and now they had to share their bedroom problems with a stranger. They had already been through so much. Why were they being put through another humiliating step to do what others could do in private? Their doctor informed them that using a donor egg was the only option for them to have a biological child, and the next step in their fertility treatment was to talk with a professional counselor. That would be me. The donated egg would come from a stranger, and they would not even know her name. I hoped I could put them at ease enough for them to open up. I knew I could help them, and they needed a space to say things they may never say to another person. Will this baby feel like another woman's child? Susie asked me with obvious anguish, as Lance squirmed, uncomfortable with the rawness of his wife's emotions. Even though they chose their donor together, Susie still had unvoiced concerns. So my job was to address their fears, understand their grief, and show them that their future child's perspective. Even though they weren't sure if the medical procedure would work, together we would speculate about the psychological and social complexities of donor conception to prepare them for this life-changing decision. We would talk about very private feelings and attempt to see things through the eyes of everyone involved: the child, the genetic parent, in this case Lance, the non-genetic parent, in this case Susie, and the donor, an unnamed woman whose egg would be used. So that sort of gives you a little bit of a glimpse into kind of what happens when people first come in and we talk about things, and we really have this amazing space to be able to share information and to share their deepest feelings about this process that they're going through.
Thank you so much for that, Jana. It was beautiful as well. And I do have first question here. So if you could take a look at it.
Sure. It says, do you have any tips on how to convince your partner to get involved in the process of telling our donor egg baby about her conception? Our child is 5 now. Yeah, that's a really great question. It is a very common challenge that one member of the couple is ready to tell or talk about it and the other one is not. And so in that case, what I do suggest is that you take some time to work through the exercises in my book, because what that will do, it will help you to identify what his or her concern is, what your partner's concern is, and then you can start to identify that concern and how to address it. So I give you the concern and then how we address that, some of the challenges or the thoughts you're having about that concern. So it really depends on what is bothering your partner. And, if you can elaborate on that, I'm happy to elaborate on an answer as well. So, but yeah, it definitely, sometimes people just don't know the language to use or how to say it. Or sometimes people think, well, my child's too young, they're not going to understand. And so why would I talk to them about it? But what we do know is that children are able to absorb information, and that the younger you tell them, the more effortlessly they're able to just take it in and accept it as part of their story. And then later, as they get older, when maybe some more challenges might come up,
they actually have that foundation of knowledge already to build on, and that confidence. And it's usually very positive when they're little, because you can just tell fun stories, and it's kind of, about cute little storybooks, and they usually don't have a lot of challenges around it at that point. So it's a great time to establish a really positive language around donor conception. But I would say just grab a copy of my book, honestly, and see if that can help you to identify some of the issues that are going on there.
Thank you for the question as well as the answer, of course. And let me see, we have more questions. So let's go ahead to the next one.
Sure. It says, do you have patients coming back after successful IVF with donor eggs, meaning resulting in a live birth, and have some problems, or is this rare? Yes, I do have patients coming back. And that's when, we've established a relationship. And in fact, I talk about a case in the book that I didn't get to talk to about today. And it's Taylor and Jack. And Taylor and Jack came back to me afterward because Taylor was having trouble. Her daughter was now 3, and she was having trouble with the loss she had gone through. So they had their last embryo. They were able to become pregnant, but it ended in miscarriage. And they had gotten far along in the pregnancy and even named their baby, and that was their biological baby. So what she found is, even after she had used a donor's egg and had a baby and was so happy as a parent, she still was grieving that miscarriage, that loss of that biological child that she was pregnant with. And she was still grieving that loss and wanted to come back to me and talk through that grief and really just kind of work on the issues that she didn't work on back then. And that's completely normal. Grief does come up later sometimes when your child is here. And I always tell parents, don't worry about that. Just look at it, take a look at it, and try to take care of yourself and reach out for help if you need that, to talk to somebody, because that grieving process is important for you to get to that full acceptance of who your family is today. I had to go through it myself. I did. I went through the grieving process even after we brought our daughter home from China. I remember feeling a lot of grief still, and kind of feeling guilty, like I shouldn't be grieving this. I shouldn't be feeling bad. And I had great advice. People saying, don't add grief. I think it was a book about adoption that I read, and it was like the secret thoughts of an adoptive mother, and it said, don't feel guilt on top of grief. So we shouldn't feel guilty for grieving. And I thought that was really important, to give you permission to feel that and not feel that guilt. And that will just help you to work through it. So hopefully that helps.
Perfect. Thank you. And let me see. We do have another question here. Let's have a look.
It says, when do you recommend to not tell the child about the donation? Which circumstances would justify not telling? At which age should one start? So really, you can start as early as possible. There are now many, many children's and baby books on the market about egg donation. Some of them are really great. And so you can start right away reading storybooks to your child, and they just take in that information naturally as part of their story. And then you can just kind of keep talking about it throughout the years in different ways. And I do give examples in the books of how to do that. And then, so I would say start right away if you feel comfortable. Just kind of, that helps you to practice too yourself, so you can get used to the language and saying it out loud. And, it helps you kind of get comfortable with it before they really realize, what's going on. Children don't understand the actual technical aspect of conception until they're around 7 years old. And so they won't really understand what you're talking about, but you're using very basic, simple language, and they can form concepts around that. And so it just unfolds naturally over time that way. You also said, do you recommend you don't tell the child about the donation? There are only a couple situations I do mention in the book. One is if your child has special needs and the information would be too complex for them to comprehend. If they have a special developmental need that it would just be too confusing, you may want to just talk to your doctors about that and see what they're able to comprehend. The other time I don't recommend telling, and I just recommend you wait, is if you're going through a family crisis. Sometimes during a divorce, unfortunately, this information gets spilled out by an unhappy parent or family member in the fight. And that can be really, really difficult for children to have two upsetting pieces of information if they're older, to find out at the same time. So I would say if they're going through any kind of a family crisis and you haven't told yet, just don't tell then. Just wait a little bit until things settle down to tell them. So hopefully that answers. I think I've got that. Which circumstances? Yeah, same thing. So
perfect. Thank you as well for this question and for your help. I am sure it did help. Okay, and let me have a look. Yes, we do have another question. Here it is.
So this says, I feel like a failure that I can't have a baby with my own egg, and I'm afraid something would happen and I won't bond with the baby. I know that is silly, but it's a genuine fear. Yeah, mainly in case it happens due to postpartum depression. I feel my husband is doing his best to understand, but it's not the same for him. Okay. Yeah, thank you for your question or for that statement. I mean, sharing that feeling is so hard, and I understand that you are not alone. A lot of women feel that way. They feel that there is those feelings of failure, or they're feeling inadequate. And I will say men feel it too. If their sperm count is low, they also feel the same feelings of inadequacy. And so I would just remind you that it is usually a medical condition that causes that. And so I like to think about lifting the shame around that medical condition, that we want to understand that even though we do naturally tend to feel shame, that it is something that you can't control. And so when you look at bonding with the baby, yeah, it's a genuine concern. We think of a bond. A lot of times we will bond with the idea of our baby before we even conceive. We can form a bond with an idea or a concept, and anytime we lose that bond, we feel loss. And so a lot of people will think about what their child would look like before they're even conceived, or imagine how they would share their genetic traits with their partner. And so to lose that can be a core loss for many people. And when you have that broken bond, or that broken bond and that broken dream, you really do have grief. And so that's part of it. It all comes, part of it. Bonding does then happen usually once you're pregnant with the baby, and even after the baby is here, you start to form that attachment process can begin, and it actually begins in pregnancy for some. But attachment is what happens over time with repeated care and repeated sharing of life's events. And so that is how we then bond or attach long term, is by that time we spend caring for our child. Now, again, if there's something that gets in the way, like depression, yes, you would want to take care of yourself. You would want to go see your doctor, and you would want to do the best you can to get the help you need for that, because depression can interfere with bonding across the board, whether it's a biological child or not. So that is a good concern. It's good that you're thinking about it. It's definitely not silly at all, and it's very legitimate to feel that way. Your husband is probably doing his best to understand, but you're right, it's not always the same for husbands. They have different ways of coping and dealing with infertility that are natural and healthy for them, but they're not often like how we cope with infertility. Women tend to want to tend and befriend and talk about it and talk it through, where men often need to distract and compartmentalize and sort of shut it out and shut it down. And so that can kind of create some tension between the couple when you have different ways of dealing with that sadness, that grief, and that challenge. And so I talk to couples all the time about this, and I actually think I even have a YouTube video, an older one out there, about the challenges between couples. So you can look that up and watch that for even more information about how to sort of communicate with your husband. So,
okay,
thank you for sharing.
Thank you for sharing as well, right? As well as the answer, and your help definitely is helpful. Let me see. We have another question here. There it is.
Sure. It says, I'm going through the egg donor process now, and I'm quite early in the process, and I'm still struggling with accepting this fully. Not enough to put it off, but I don't have a partner, so I'm going through this process with my very close male friend of over 15 years. So I almost feel like I may be a surrogate to him. Is this completely irrational? So let me see if I understand. You feel like you're a surrogate to him, but I think you're not, doesn't mean you're actually a surrogate. So I may need a little more clarification on the last one. So anything you're feeling, for one, is not irrational. I mean, feelings, you're in a, infertility and this process does bring up so many emotions. So it's okay. Like I said, my book, it really is a guide to working through your feelings. And, you can, I have like a checklist where you can say, I'm feeling this, I'm feeling, sad, angry. And so I would just say, understand that what you're going through is difficult, and that if you need that support, go get that support. If it's your male friend and he's supportive to you, that's fantastic. Wherever you can get support is important. And feel free to retype and elaborate on that question, and I'm happy to answer it.
Yes, exactly. Go ahead, okay? If you could add something, I'm sure Jana will be able to help you out a little bit more. All right. In the meantime, let's have a look at the next question here. Here it is.
How do I explain to a child 5 years old that she was conceived through egg donation? How to make it simple? Is it really possible? Oh, of course. Yes, it's most definitely possible. I actually talk about that. It would be called the preschool years. So if you have an entire chapter dedicated to this topic, and how to talk to your child in the preschool years. So when they are 5, and you can use simple language and simple phrases. I'm actually going to turn to that page if I can do it quickly in the book. But you use the concept. So remember, children at 5 years old don't understand how conception happens yet, but you can still use concepts that they can definitely understand. And this gives them a foundation to build from. As they get older and the information becomes, their brains become more advanced and the information more complex, they can learn to comprehend that better. So think of it like you're building. 5 years old, basic language. Each stage is different. And I talk about that in my book through the years. So I go from preschool to middle childhood and then over to adolescence or teenage years. So you can look at that and find. You want to set it, use a positive tone with your 5-year-old child, but you want to tell them that, you needed a little help to have a baby, and that you got help from, some people say a gift, some people say a seed. There's lots of different language out there around this concept. So again, tons of storybooks that you can purchase and help you with that language. And so you're just reading them a story about it, and you don't necessarily have to say much more than that, than just read them a story. So grab a copy of my book for actual phrases that you can use. And I'm not having an easy time flipping to it. So, but you will be able to get the information there that you need. So.
All right. Perfect. Thank you so much again. Now let me see. Okay, here it is. Next.
Yes. I was never pregnant with my own eggs. Do you have patients that feel guilty after having 9 biological children? And so I think what you're asking is that you guilty. Do you have patients that feel guilt after having non-biological children? Maybe you mean you've had a baby with egg donation, and you're thinking that sometimes people feel guilty about that. I imagine that happens. Most of the patients and the clients that I see do talk to me about that more beforehand. Sometimes they do come back and talk about guilt, but I think it's more grief than guilt, if that makes sense. But again, if you can elaborate on that, what type of guilt, or what maybe specifically what you mean, what are they feeling guilty about? That would be helpful, so I don't just assume.
I guess that she did say that actually it's about egg donation.
Okay. About egg donation?
Yeah, I guess so.
So what is it? So I would just want to know what aspect of it, what part of it is the guilt from? Is it, because there's so many things, so I wouldn't know how to speculate.
All right, if you could just get back to us, okay? Jana will be able to help you out a little bit more, okay? Thank you. And again, in the meantime, let's have a look at the next question here. There it is.
So if telling the truth will make his or her life complicated, or Vit says very complicated, in the culture country we live, do you recommend to keep it until he or she is grown up? That is a good question. And I think you'll have to make that own judgment based on your culture or country that you live in. I think what you can do, if you do feel like that is too complicated to tell because of your culture and country, then there are, again, words and scripts in the book to talk to them about the topic when they're older. And you can tell them why. You can say, we didn't want to tell you sooner because of what might happen in our lives, and you and only you know that. And so then you can say, this was our way of wanting to make sure that you didn't have to deal with some of the extreme challenges. I'm assuming they're extreme challenges that we couldn't address. That I would go, some of the challenges in the book I address, and these are challenges we can all manage. But you may have some extreme challenges that I'm not familiar with, having living here in the U.S. So yes, that there are terms and things that you can say when they're older to help explain why, and that's something that you can look into in the book as well. Mm-hmm. Just out of curiosity, where do you live? If you can share that, if you feel like sharing that.
All right, thank you.
Mm-hmm, sure.
Let's have a look. Okay, here it is.
So hi, I'm currently going through the egg donation after 2 failed IVFs. I'm so sorry. The problem is that the clinic has now twice found me a donor, and I just cannot go through with it. I get really upset, even though I've been told it would be impossible for me to have a child of my own. How do I reconcile my mind? Oh, I'm so sorry. I know that must be very, very hard. I would say that, I would say that you don't necessarily, there's no way to really reconcile it. And I'm certainly not in the business of convincing you to do something that you don't feel comfortable with. What I do is, once people have made the decision for themselves and they want to move forward, then I help them and say, hey, okay, you're going to do this. So here are some things to prepare for, and here are the challenges ahead. But I don't necessarily wouldn't convince anybody to do something they're not comfortable with. No, I wouldn't. So I would just say, again, there's a big grieving process when you can't have your own children, or you can't have a biological or genetic child. That is a core loss, and a core loss, you will grieve that, and that will be difficult to go through. But just say, allow yourself to feel those feelings, and there's no rush. I do have some patients tell me that they don't necessarily realize they didn't need to rush through to the decision, that they could have taken their time and sort of worked through some of their emotions. But you have time to work through it too after the process. So there's never too late. It's never too late to be able to address your own concerns about this. So, do we have any more questions?
Yes, we do. We have a few more.
Okay.
Just so patient is from Turkey.
Oh, okay. Yes.
Right.
Okay. I understand.
And let's have a look. Yeah, we have a few questions. We will be slowly finishing, but let's have a look at those questions we have left. Here it is.
I've seen some internet support groups online, communities set up by adult donor children. Do you think our donor children may have some psychological problems in the far future? Well, there are research studies that have been done about adult donor conceived children, and that varies. The reports vary. There's some do fine and are well adjusted, and then others are struggle a little bit more. But each of it depends. It really all depends on the circumstance. It really depends on when they were told, how well the family dynamic was, if they were a family that functioned well and pretty happy and healthy, or if they maybe struggled in some other unrelated areas. And so what we also see is some more recent research too that suggests that children in donor-conceived families are as well adjusted as families who have had biological children. We can also look to the adoption community, and we see that many adopted children are very, very well adjusted as well. So there's a lot of exceptions, and there's a lot of reasons. But I would say, if you're open and you're adaptable and you're accepting, then you are going to be minimizing those psychological problems that they may have. We also find that children have less psychological issues with feelings. They have less feelings of betrayal or feelings of identity issues if they do find out when they're a little bit younger than if you were to spring it on them when they're a teenager. So they tend to struggle a little bit more then with sometimes feeling feelings of betrayal or confusion and identity confusion. So, that's kind of that's what we're seeing. But more research needs to continue to be done on families that have been donor conceived. So.
Perfect. Thank you. I believe we have the last question here. Okay. It's
Very good.
a longer one, but have a look. Okay.
Okay. Hi, Jana. Thanks for reading my question out. And as soon as I typed it, I realized I did it incorrectly. No problem. Myself and my friend are going through the process, but I worry that I will just be having the baby for him if it works, since we aren't in a relationship and it would be my own eggs. Okay. We would co-parent, but I'm still struggling with the whole idea. He is supportive, but I don't really think he fully understands why I'm struggling. Okay. Does it make more sense? It does. Yes. Also, please, can you repeat your answer, because the sound went off. Oh, I'm sorry about that. And so, yeah, and I don't know if you're just starting the process, I think, but you definitely want to be comfortable with the process. That's a big decision. And, if you don't feel like you're on the same page, you might want to just have some meetings with him, or maybe even talk to a counselor or a consultant about it, and just see what the concerns are that you're having, and if it's something you still want to move forward with. Yeah, it's I definitely see your problem, or your position that you're in, can be difficult, and that you may want to take a step back and then just have some more conversations around it, if you can. And if you are already in the process and I missed something there, then yeah, you definitely want to talk to a counselor, and go in together and talk through it, so you can feel more at ease about the situation.
Thank you again for the question. Again,
Sure.
Jana, for getting back to us with the answer as well. Let me have a minute, okay? As I see, there are some patients that are writing, so I just want to make sure all the questions have been answered. So just to wait a second. If not, as I said, we will be finishing.
Okay.
All right. I guess everyone just want to really thank you.
Very good. Oh, thank you. I'm so glad for being here today.
Just so you know, it has been recorded, so you will be able to watch it tomorrow. It will be, of course, available on our site. Okay. Again,
All
I would
right.
like to thank you all for joining us today, for all your questions, but also for sharing those your stories, because I know it's never hard for you. It's always hard for you. Jana, well, all I can say, we should do it definitely again.
Okay.
And that's all I can say, really.
Okay, thank you.
And I wish you all the best, and I hope all your treatments will be positive, with positive results. Thank you all, and good night. And I hope you can join us next week as well. Thank you, Jana.
Thank you.
It was lovely to have you here.
Okay, it was great to be here.
Thank
Bye-bye.
you. Bye-bye.